everyone. My name is Kai Carter, a junior health science major on the pre-med track from Charlotte, North Carolina, and I serve as the CNAHS local chair on the Elections Commission. Today's Speakout is designed to give candidates an opportunity to share their platforms and plans for their desired position within the student body. It also is an opportunity for the student body to get to know the candidates in a more intimate setting beyond campaign posters and flyers. The candidates will be answering moderated questions that have been prepared. Each candidate will have 1 minute to respond to each question. At the end of the moderated question portion, the audience will be able to pose questions to the candidates and their platforms and intended plans for their desired position. Again, candidates, you will have 1 minute to respond. Please hold all applause until the end of each portion of tonight's event. Again, thank you for attending tonight's event, and we will now begin. Candidates, please take 30 seconds to introduce yourself and your platform. Thank you, candidates.
Good evening, everyone. My name is Farida Adoye. I'm a junior nursing major, and I'm vying to be your next CNAHS Council Executive President.
Hi, everyone. My name is Savannah Rogers, and I am a freshman health science major on the pre-medical track from Houston, Texas, and I am running alongside Farida with the Vital for CNAHS campaign. It stands for Visibility, Innovation, Legacy, Access, and Transparency. Thank you.
Good afternoon, everybody. My name is Darren Wallace. I'm a junior nursing major, maternal and child health minor from Atlanta, Georgia. I'm running to be your next CNAHS Executive Council Vice President. Thank you.
Good evening, everyone. My name is Tiffany Armand. I'm a junior health science major, chemistry biology double minor from Montclair, New Jersey, and I am ready to be your next College of Nursing and Allied Health Sciences President.
Good evening, everyone. My name is Rakonda Davis. I'm a junior health science major in the pre-medical track from Philadelphia, Pennsylvania, by way of Kingston, Jamaica, and I'm ready to be your next Executive Council Vice President for CNAHS.
Good evening, everyone. My name is Swadu Berry. I'm a freshman health science major, philosophy minor from the Bronx, New York City, and I'm running to be your next CNAHS Executive Council Treasurer.
Good evening, everyone. My name is Kaya Joseph. I'm a sophomore health science major, chemistry minor from Clarksville, Maryland, and I'm running to be your next CNAHS Secretary.
And we are running on the slate Paramount, Ours to Elevate, Ours meaning Opportunity, Unity, Restoration, and Support. Thank you.
Thank you, candidates. At this time, we will now move into questions for tonight's event. First question. The College of Nursing and Allied Health Sciences serves students across a range of disciplines and varying needs, many of which are shaped clinical, off-campus, and highly structured academic experiences. How does your slate's vision reflect these realities, and what specific initiatives would you implement to better support CNAHS students?
Thank you so much for that question. Vital, one of our pillars is access. A big part that clinical students face within our College of Nursing and Allied Sciences is financial barriers. For a lot of our programs, you have to pay for our own supplies, including uniform and scrubs, which is $300, stethoscopes, and so on and so forth. This is a big problem that CNAHS students face as a whole. Our platform, through our pillar of access, ensures to help remove these financial stabilities, which we're already doing through our current positions across the school within CNAHS. And we hope to just help use our budget to alleviate those financial burdens so that students will not have to worry about these things through our platform. Thank you so much for that question.
Again, thank you so much for your question. The S in ours we support, and one thing that we definitely want to do with our budget for CNAHS, while we can't allocate our budget for scholarships and different various resources, what we can do is use our position to write referendums to the Houston Senate so that we could get more allocations of funds for CNAHS students. Thank you for that question.
Second question. Students within CNAHS often express that they lack access to the same level of resources and visibility as students in other schools. How would you advocate for increased support and ensure CNAHS students receive equitable access to opportunities and services?
Hello, everyone. Again, my name is Savannah Rogers, and something that I really want to start to do for CNAHS is create a website for CNAHS. I really want to be able to add on scholarships to that website, and then also monthly newsletters so that you guys know where your money is coming from. So that is something that I would definitely do, and then also having monthly meetings with the dean just to see where we can allocate funds and things like that, because I know that funding and scholarships is something very big that runs not only just in CNAHS but in Howard in general. So yeah, that would be my answer to that question. Thank you.
Thank you for that question. So our council, what we want to have is open office hours for CNAHS students to come in and talk to us, the council, to voice their concerns and anything that they have, need worries about, or they're struggling with, so that we can go to the deans, go to the faculty, and address their concerns, as well as just having an open forum so that they can say whatever they need help with.
As CNAHS is now off campus, CNAHS students often experience a disconnect from broader campus life and student government initiatives. How would you work to ensure that CNAHS students remain visible, engaged, and adequately represented within the larger university's community?
Thank you for that question. So currently I serve as Deputy Chief of Staff, and I realized that there is nothing, unfortunately, that we can do about shuttles or moving our school on campus. So all that we can do is unify ourselves. Like in our pillars, unity, we are going to focus on movie nights, like CNAHS on the yard. So that would be having everyone in CNAHS come together, have a movie night on the yard, because we do, at the end of the day, belong in the yard, even though we aren't technically on campus. And also, at the end of the year, we plan to host a gala celebrating everybody's achievements, awards, because we don't have that often, and CNAHS doesn't get that recognition that it deserves. So we want to give the opportunities for y'all to put on your resumes awards and achievements and all these other things, because you guys do deserve those accolades. So yes, thank you.
Thank you for that question. A big thing that I've done this year as Ms. College of Nursing and Allied Health Sciences is when we have special events on campus, to talk to the faculty and Department of Student Affairs to increase the amount of shuttles coming to the building, so we can gather more students from the building over to the main campus. So being able to continuously talk to administration to ensure that the transportation is in place for more students to go back and forth when we're having large events on the yard, so that students can also feel a part of what's happening on this campus as well. Another thing is also, even though we're on CNAHS, a lot of majors in co-ops and other schools, we're all vying to be health professionals anyway. Biology majors, chemistry majors, some of us are all heading towards the same goal. So ensuring that we have interdisciplinary events where we can all come together, events where we can all come together and share our different skills, resources, so we can all learn to be healthcare professionals together, is a great way to unify ourselves to the main campus. We're not just CNAHS, we're all hoping to be healthcare professionals. So really just connecting ourselves with the other colleges on the campus as well. Thank you.
Last question. CNAHS students often navigate rigorous academic schedules. How would you advocate for policies or initiatives that support both academic success and student well-being within such a demanding environment?
Once again, my name is Darren Wallace. So in CNAHS, a lot of the time students don't even know the opportunities that are available for us, especially with things such as nursing, health management, pre-dental, pre-med. A lot of people looking for shadowing opportunities and things of that nature. So we recently just got designated as an R1 research institution. So a lot of people are able to get research hours at the Howard University Research Center. Across the reservoir, we have the Children's National Hospital where people can also get research hours at, or shadowing hours. Also have MedStar right across the reservoir. You have MedStar in Georgetown. You have a lot of different hospitals where you can get resources and experience in healthcare without Howard necessarily being the ones backing it. So just allowing Howard University students, specifically in CNAHS, to know that these opportunities are available for them is definitely a big goal. Thank you.
Again, my name is Swadu Berry, and how we do this is we want to create a spreadsheet that will have links to different types of internships, opportunities, scholarships, and things like that for different pre-professional tracks. Not only do we want to focus on every single major as well as every single pre-professional track as well. Being able to have these opportunities for every single CNAHS student to be able to not only feel included, but know that there are resources out there for them, and to know that there are people rooting for them. So along with that, we do want to have a CNAHS professional group meeting where faculty, staff, and every CNAHS student is able to be in it, so that when opportunities arise, when research opportunities arise, when professors need help doing things, CNAHS students are the forefront there and are able to have these opportunities readily available to them. Thank you.
Okay, this question is now directed for the president. There can often be a gap between student needs and administrative action, particularly within specialized programs like CNAHS. As president, how would you strengthen communication and accountability between students, faculty, and administration?
Thank you so much for that question. As president, my number one priority is to also make sure that we're consistently having meetings and communication with faculty. The CNAHS faculty have so many resources, opportunities readily available for us as so long as we're willing to take it. So to continue to make sure that we're having monthly meetings with the dean, as well as student affairs and any faculty available, just to make sure we're discussing what the students need, and we're also discussing what the faculty have in plan for us. A good example of this is as Mr. College of Nursing and Allied Sciences, also a nursing major as well. A lot of our professors are also and different specialized needs for nursing. So one of them actually has one of their own CNA companies. So being able to put nursing students onto those opportunities to get those CNA for free was a big thing for all of us. And just to continue to do things like that, using their resources to help strengthen the students as well as their credentials. Thank you.
So currently as Deputy Chief of Staff, we were able to run town halls where we had multiple opportunities to meet with the dean and multiple faculty within CNAHS. And through that, I was able to build really great connections. I was also able to build really great connections with the provost of the university during my time of Senate. So I would use my sources and my community and my network to ensure that whatever you guys are coming to us with is going to be exactly to the faculty, and we're going to advocate for you guys. I've been building connections within CNAHS since my freshman year as a health science major. We don't have as much support as maybe some other majors within schools, within CNAHS, so I had to do a lot of that stuff on my own and make those networking connections. So I would just utilize that and just continue to advocate for y'all, and that's literally all we can do for you. So yes, thank you.
CNAHS students often require access to specialized resources, including clinical preparation, licensing support, and career readiness opportunities. How would you work to expand access to these resources for all students within the school?
Again, my name is Darren Wallace. That's a great question. So in a lot of different programs in CNAHS, there's a lot of different things you can do to actually get experience on your resume, whether that's you getting your CNA license, like for nursing, getting your phlebotomy license, getting CPR certified, BLS certified, things of that nature. So not only would I be able to bring these different companies here to Howard University, but I'd also be able to partner with different companies or organizations on campus, such as the Red Cross Club, CPR Club, things of that nature. In my position as Director of Campus Health of the Howard University Student Association, I have a lot of resources in terms of being able to outreach to different healthcare organizations and bring them to campus and have them able to teach students for free and allow students to get all these certifications that they need or they might want for their application for maybe postgraduate schools, even for summer internships and things of that nature. Thank you.
Thank you so much for that question, Ian. As the current Mr. College of Nursing and Allied Health Sciences, I've been able to curate many various connections with individuals within the healthcare field. And one of our platform initiatives is actually called Stand Out. We will actually have CNAHS students be connected to individuals who can give them those certifications, like BLS certified, naloxone certification, because we want them to understand we all want internships, we all want externships, we all want to be ambassadors, but able to have that our resumes have to speak for itself, which is why we call our initiative Stand Out. We also have Grind Over Matter, where we will be able to connect with various alumni within CNAHS that have already graduated from Howard University. We have to lean on our network, and our network is our network. So that's why we have to use our alumni connections to come back in and talk about and also help and give back resources to our CNAHS community. It is our responsibility to elevate our school. Thank you so much for that.
Transparency in financial decision-making is essential to building trust. What systems or policies would you implement to ensure accountability and clarity in how the council funds are managed?
Hello again, my name is Savannah Rogers, and my answer to that question would be to make sure that it's not just one person looking over funding, making sure that everybody in the council is looking over funding along with HUSA. What I would do is make sure that everything is going right. Like I said earlier, I would create those monthly newsletters and to just make sure that transparency is being allocated to all the CNAHS students. The T in VITAL stands for transparency, so that is one of our initiatives. And then, like I said earlier, the newsletter and then also my website. I would definitely want to get those scholarships and things like that on the website. Can you repeat the question for me one more time, please?
Yes. Transparency in financial decision-making is essential to building trust. What systems or policies would you implement to ensure accountability and clarity of how the council funds are managed?
Okay, yes. So in that newsletter, I would make sure that you guys know where exactly all of the money is going towards. That way the money's not being shadowed or not being seen. So yeah, that's what I would do, and that would be my simple answer to that question. Thank you.
Thank you for that question. Again, my name is Swadu Berry, and truthfully, it would be make everything public. To have a system that flows naturally, I'm a pretty organizational person. I'm handling the funds right now for our campaign team. It's been going really well. Having a system and having people that you can truly rely on and know that they're fact checking everything. I'm very, very detail oriented, so not a single cent gets past me truthfully. And I feel as though having that organizational system and being able to rely on the people that are on your team makes everything so much smoother. And then again, making everything public. People want to know where their money is going. People pay to be here. We all pay to be here. So understanding that allocating funds is a huge part of creating a successful student council. So just being able to make that public will hold everybody accountable, including higher up administration. Thank you.
How would you ensure consistent, transparent, and accessible communication between the council and the CNAHS student body?
Thank you for that question. My name is Kaya Joseph, and how I would ensure consistent and effective communication between the council and the student body would definitely be having just open communication, sharing everything, emails, having forums, and definitely programming. It's very important that students within CNAHS see that the school is having active programming that relates to their events and what they want to do in the future, because that's important and crucial for the career path that everyone wants to go on. Thank you for that question.
This now concludes the moderated question portion of tonight's event. The audience will now have an opportunity to pose questions to the candidates. Audience members, please make sure that your questions are general. This is not a crossfire, and any pointed questions should be reserved for that event. Again, candidates, you will have 1 minute to respond to each question. We will now take questions.
I'm just curious to know, I feel like everyone, regardless of their major, kind of comes from some place where they get their passion for what they do. I mean, I'm just curious to know, like, what really lights y'all's fire? What really makes y'all really want to do this? What can make me trust y'all?
Hi again, my name is Savannah Rogers, and that's a very easy question. Thank you so much for asking that question. I aspire to be a pediatric doctor one day. I would say that kids are definitely my passion and my inspiration, whether that's from pre-K all the way up to seniors in high school to students right here. Recently, this past spring break, I was in alternative spring break where I was at a charter school and I was able to work with pre-K students. One of the pre-K students, her name was Ariana, and she told me that she also wants to be a doctor for kids whenever she grows up. So she was one of my huge inspirations during ASB, and it just really reminded me, like, yes, I'm doing this for myself, but I'm also doing this for Howard as well. And honestly, my future is what drives me. I want to be the doctor to help be to be the representation to little black students and little black kids that need healthy childhoods. Because at the end of the day, you're always going to look back at your childhood and see, oh, this is how my childhood was, and I want to be that doctor to be like, oh, you're able to have that healthy childhood, and you're able to grow up to be as such. Thank you. That's my answer.
Hi again, my name is Raquanda Davis, and I'm from Kingston, Jamaica. Growing up in Jamaica, I saw the health disparities right in front of my face. My grandmother had diabetes and arthritis, but she wasn't able to get the health care that she needed because she didn't have the correct insurance. Because of that, my passion for health equity sparked. I was able this summer to become a second author for a research article on how to make cancer research more accessible to marginalized communities. I'm also a second author for the Consortium of DEI Health Indicator, where I use affirmative action to figure out how to make medical school application process more accessible for individuals a part of the black community. My passion for research and my passion for healthcare is what drives me to be a trailblazer in healthcare. We all come from somewhere, so we want to use that to be able to help individuals within our field. Thank you for that question.
So my name is Darren Wallace. So growing up, grew up in a single parent household on the east side of Atlanta, Georgia. My mom, she's a nurse. My grandmother, she is diabetic and she's blind as well. My grandfather has diabetes on my mom's side, and then on my grandma's side, my grandparent has arthritis as well. So I grew up seeing a lot of different health disparities in my family in general, and doing nursing, it's obviously a woman-dominated field. The reason I wanted to go into nursing is because, like, growing up seeing my mom every day, regardless of what we had going on in the house, I was able to see her get up and on her scrubs and go take care of other people, and that kind of instilled selflessness in me. So growing up, I always wanted to be able to help other people no matter what I do. It sparked my interest in middle school. I was in a healthcare program in middle school and high school as well. Came to college and I want to do healthcare and I want to be a nurse because I feel like nurses are most hands-on when it comes to actual patient care and actually being able to talk to patients and kind of not only be like the healthcare provider, but also their therapist and help them like figure out things that they might not be able to say. But also kind of a detective in that role. So even like a administrative role. Thank you.
Hello everyone again, my name is Swadu Berry, and honestly my passion started at a very young age. Having a friend who passed from cancer at a very young age that was the first exposure to healthcare that I had. My mom is also a nurse, so she does work very, very hard for our entire family, and I've seen how being able to help people just transcends into your entire life. It truly puts a spark in you that nothing else can, and so that just continued as I've been able to help others during high school as an EMT and as a CNA at a hospital as well. I've just been able to be exposed into that patient care, and I know I want a bigger role for myself. I've been able to work with doctors and see the passion through there. And as for council, my passion for treasurer comes from just the disconnect that I've seen in the past semester working on freshman council, seeing the issues there and knowing that truly a change does have to be done. So I've generally been able to see and witness the issues firsthand and know that if I was able to step into this role, that is something that I would be able to do. Thank you.
For me, I've also been interested in healthcare from a very young age. My mother is also a nurse. But what continues to light the fire, as you said, is consistently being in the healthcare field. I currently work as a patient care technician at Georgetown. And a big thing for me is to continue to advocate for the Black and brown and minority patients. A lot of times people refer to us as like the harder patients because, a lot of these patients are most times, newly paraplegic or things of that nature. So they're still sad, they're very emotional because they're going through all these changes. Being able to advocate for them and to remind other workers like, hey, like they're going through a lot. Their whole world just flipped upside down in a few days. And consistently being the voice to advocate for them is what drives me in healthcare. We need more people like us to continue to advocate for us. And even now, translating to wanting to run for CNAHS Council President, to see so many things going on within the College of Nursing and Allied Health Sciences over the past few years, which I've been heavily involved in CNAHS, I see so many things that I want to see and I want to continue to, I see so many things I want to change, and I want to be the change that I want to see, and that is why I'm also currently vying to be your next CNAHS Council President. Thank you so much for that question.
And I want to become an OBGYN, and honestly the passion behind that is really the maternal mortality rates with especially Black women and how we're oftentimes discriminated against and often overlooked just because of the color of our skin. And so I definitely think that accessibility and education are two really key details that we really need to have in our healthcare systems. And even just a small step as serving as your CNAHS Council secretary, especially opening up the communication and really bridging that gap with education and accessibility, I think is really crucial. So that is what fuels my passion. Thank you for that question.
Thank you for the question. So personally, growing up, my parents always instilled in me, treat people the way you would want to be treated, and I think I took that a little bit too seriously because everywhere I go, I always ensure that however I'm treating someone, that's exactly how I would want someone to treat me, my family, my friends, anyone who's surrounding me. So when I think about when I'm becoming a doctor, I think about being the face that I would want to see somebody come up to me with and be that voice and be that advocate and be that person that's going to help and hear your problems and needs. So that's something that I'm very passionate about, and I take it very seriously. I'm like the youngest of two older sisters, and they're very soft-spoken, so I've always been that type of person to be outspoken on behalf of others, so that comes very naturally to me. And then as far as on campus, like I said before, I've been involved with student body government since my freshman year, so I see when people get voted into like positions and they don't actually deliver on the promises that they gave you to begin with. So, thank you.
We will take another question.
My name is Nia Riley. I'm a freshman nursing major from Fairfield, California. And I just wanted to know, what is something that you feel sets your slate apart from the other slate, and then how tangible are your initiatives?
Thank you for that question again. My name is Swadu Berry, and honestly, I would say passion and the tangible initiatives themselves. We already have curated a good list of tangible initiatives, like you said, the Standout series, and other initiatives like that are actually actionable and aren't just super vague, and there are things that we can do as a council because, again, there are things out of our reach, so I would never want to fulfill a promise that I know couldn't be made. And so I feel like having that list already prepared, if elected, we would be working on that right away and have those issues
be able to be resolved for the next school year, and be working on that throughout the summer. And these are tangible items that aren't super far-fetched as well, and they aren't super vague. So, for example, like the Standout series, creating that group meme, navigating CNAHS.com, things like that really set our state apart. Thank you.
Thank you so much for that question. Again, my name is Farida Doy, and I think a big thing that sets our state apart is two initiatives that we hope to start. And one is just making our pillar of legacy, ensuring that ensuring that students aren't just prepared for school here now, but also prepared post-grad. Post-grad is a big thing for us. We feel as though a lot of students at Howard, especially in CNAHS, with our programs being so rigorous, they're so focused on let's just try to get through school, and they're not even thinking post-grad. We want to prepare our students for not just success here at Howard, but beyond. So that's a big, big thing that we really focus on. And as far as tangibles, each and every single person on this slate has served on CNAHS Council or in a CNAHS position before. Savannah currently serves as CNAHS Council as a freshman president. Darren served on Impact Council with me. I served as an intern on Charge Council. I served as Community Service Director of Impact CNAHS Council, and as College of Nursing and Allied Health Sciences, I currently work with Core Council to help establish some events and initiatives. So we know what's tangible and what's not based off of what the past 3 councils have done and seeing it up close and personal. So through our experience, we can definitely say that our pillars and initiatives are very tangible because we've seen what can and cannot be done before. Thank you.
Thank you again for that question. As serving as Mr. College of Nursing and Allied Health Sciences, a big role and a big part of my job is listening to students' needs. So a big part that sets our council apart is taking what the students have said to us and implementing that into our platform. We have an initiative called the First Look Initiative. We have where that initiative will take students within CNAHS to Howard Medical School, George Washington School, giving them that opportunity to see various resources that are out there, allowing them to network with people post-grad, as we talked about, because post-grad is very important. Another big initiative that we're hoping to implement is the Excellence Without Restriction. CNAHS is very diversified. We have people from Jamaica, we have people from Africa and from various countries, but they aren't able to get different opportunities because they're not permanent residents. So what we are charged to do is create a whole department for those students so that they're able to get resources, get scholarships, and they're not limited because they're not a permanent resident of America. Thank you for that question.
We'll take one more question.
A lot of students within CNAHS have non-traditional pathways, whether they have an additional year or have to switch their major, or something happens where they can't continue their journey properly. So in what ways or what pillars or any initiatives do you have that can make those students feel comfortable with their new pathway that they have to endure?
Thank you so much for that question. As somebody myself who's had to have a non-traditional pathway at Howard due to nursing, I 100% understand how it can feel and how overlooked those students feel. So through our pillar of V visibility is just to make sure each and every CNAHS student feels seen, regardless of how their journey is. Even though you have to take an extra year, even though you have to switch your major, anything of the sort, we want every CNAHS student to know that our goal is still the same, to become a healthcare professional and to help impact lives. So we just want to ensure that there's a community for them and to have open and honest conversations. And through having consistent office hours, we want all of those students to know that we're here for them. We're here to give support and access to them. And we're also going to collaborate with the Department of Student Affairs so they can know all of their options so they don't feel like trapped or they don't feel like, I don't know what to go after this. So just make sure that they feel seen, encouraged, and supported through everything.
Thank you for that. Most sufficient way to solve a problem or to figure out what your next moves is to have your resources laid out in front of you, and that would be the goal of our website, is to have all your information that you could possibly ever think about CNAHS related centralized to one website where it's accessible. You can get advisors' numbers, emails, whoever you need to talk to figure out your path, because it is a struggle, especially when you feel like there's no one there to support you and there's no faculty, no community. I think that that's the main way that you can get through any non-traditional path that you may be taking. Thank you.
Thanks for that question. And honestly, I would say that someone has always been where you are. Someone has always gone through that path, and being able to expose people through these types of people through that group me would be really helpful, because genuinely, you're not the first person to go through something. People call it an original experience. So having somebody that you could reach out to and you could say, hey, I've been going through this non-traditional path. Do you guys know anybody who's been in this path? Because we have a lot of successful CNAHS alumni. So being able to reach out to those people, hey, what did you do? Were you able to overcome this and that? Having those resources within that would be really helpful to non-traditional students. Thank you.
Yeah, and then also, backing up what Farida said, like that was said, CNAHS does have a lot of successful alumni, and a lot of the time, people are kind of, it's a stigma around being able to say, hey, I had a non-traditional pathway in my matriculation through the major. So allowing students to know, like, hey, there's people out there that have been through the same thing as you and gotten the same goal that you want. And honestly, the journey to the goal is what makes the goal so much better to have. So knowing that there's people that have been in your position, you know, at the end of the day when you might feel like, oh, like I'm never going to get to my goal of being this or being that, knowing that, hey, this person is in the exact same position as me, might have got rejected from this internship, might have got rejected in this class, but at the end of the day also able to become a doctor, pediatrician, a nurse, a clinical laboratory scientist, anything with that nature, definitely shows people that whatever you see you can achieve regardless of whatever setbacks and mishaps might happen. Thank you.
Thank you for that question. The key phrase that we say in Jamaica is no man is an island, no man stands alone, meaning that we all need somebody to help us through this journey to get to the goal that we need to get to. With that, we have our initiative, Iron Sharpens Iron. What that does is allow individuals to meet with people in their career fields and also alumni. So you're having that mentorship from individuals within your major, and you're having that mentorship from individuals who's already done it before, who can already tell you what you need to do and what next steps you need to take. I started out as a nursing major my freshman year, and I switched to health science. So I understand what it means to go from something different and not know what direction that you need to go into, which is why we also have another initiative, Seen in Scrubs, Heard in Action, which is visualizing every major within CNAHS, and which will be on our website, navigated.cnahs.com, which will allow students to see, okay, this is what a health science major do, this is what class I need to sign up for, or if I'm switching from nursing to OT, this is what occupational therapists do, and this is what classes they have to take. So having that centralized system for CNAHS majors where it's accessible and transparent. Thank you for that question.
Yes. Thank you for that question. Also understanding that there are so many different outlets to pivot, and there's different ways to go. There's not just one way to be a doctor, to become a PA, to become a physical therapist, and just understanding having that open communication in those forums, as well as just the resources to understand and get the amount of help that you need from different faculty, from different people in the actual fields that we want to go into. And having those spaces for people to go and for people to know, okay, this is where I can go to get this information, and this is where I can go to know where I have to do this. And so knowing that you are not alone and someone has always been your sponsor. Thank you for that question.
This now concludes the audience portion of tonight's event. Let's give our candidates a round of applause. On behalf of the commission, we would like to thank you for your attendance and participation in tonight's event. Please make sure that you're following the commission Instagram account for updates about the upcoming Crossfire and election schedule. Again, we thank you for being here tonight, and this now concludes the